Hey, Kris Brown here, coming to you live from the Show Me State. I know y'all getting tired of these curtains behind me, but unfortunately I'm gonna be here for a while, so you'll probably be seeing them again. Today I'm going to talk about integration, but before I do that, I need to give a shout out to one of my buddies. He goes by the name of Strokes, and he questioned last week how I could talk about strokes and keystrokes and not mention his name. So, Paul Stockdale, here is your shout out. I also like to call Paul my Meditech father because when I was first starting out in this business, he taught me a lot of what I know. And quite honestly, without him, I'm not real sure where I'd be in this business today. So, with that, I want to move on to integration and specifically Expanse, MEDITECH Expanse. So I have the pleasure of being on one of the first hospitals going live with WebAcute, WebAmbulatory, and WebED. And so what that means in layman's terms, if you are WebAcute, that is basically inpatient, or if you get admitted to a hospital, WebED is basically the emergency room, and then WebAmbulatory is clinics, any kind of doctors that have their practices and may be associated to the hospital. So what I really like about this EHR is I mentioned it was fully integrated, but with the click of a drop-down menu, you can basically switch between these three different applications, which comes in really handy for treating a patient or even looking back at the history or any kind of medical records. And so I want to go over some pieces of the EHR, the electronic health record, that I really like. The first part would be the problem list. And so for those of you not in the medical field, the problem list is basically, your medical history, your disease states, your chief complaints, basically anything that you may have, gone to that healthcare provider to see. If you had a broken arm or a heart attack, or just really runs the gamut, any kind of a problem that you may have had in the past. And so this is all fully documented and shared between all three applications, and really any phase that you could be treated. Because outpatient procedures, if you have a surgery or something like that, are included in that as well. So really like that part of it. The medications are completely integrated. So you can see your medication history. You can see the prescriptions that any doctor may have given you, as long as they're on the same network. You can see anything that you may have had in the hospital, any kind of office injections. And now MEDITECH will is even able to go out and kind of access some prescription history from retail pharmacies. So really convenient for healthcare providers trying to make decisions about your medications. The allergies are also fully integrated. So this is a big time saver, I think. The staff doesn't have to collect that information and enter it into the EMR at this point, as long as you've been seen before at this location or at any of these locations, then that information is already there, and it's basically just the staff validating that information with you, making sure that nothing's really changed. The scheduling is also centralized, so you can have one group of schedulers really schedule for anything in the hospital, whether that be a doctor's office or some kind of surgery or a lab or an x-ray. So you're really able to have one department handle all this scheduling for everybody. So that is a nice development as well. And then the financials, whether it be in the clinics or in the hospital, you can have one department handling all these financials as well, because there's one application that basically controls all those. So that is also very convenient. And while I'm talking about financials, I just kind of want to talk about the financials in MEDITECH. And they're very solid, and I always like to get paid. I don't know about you, but I like to get paid. I'm sure the hospitals like to get paid, and most people I know like to get paid. So MEDITECH's solid in this realm, and there's been specifically one big name EHR that hasn't done well on financials, and so I'm not sure why more people aren't looking at MEDITECH because of that piece, honestly. And the other thing I really like about MEDITECH and talking about integration is it really just has any area or department in the hospital, MEDITECH pretty much has a module for, or an application for. And so, some of these other big name EHRs don't really have that, and you have to buy extra pieces to kind of go along with your software. And so, if you're a CEO, CIO, or a IT director and you haven't looked at MEDITECH in a while, I encourage you to do so because they've really come a long way with this product, and I feel like they're on the right track. With any kind of new software, even Apple, there's bugs in the system. That's always to be expected. But the integration, boy, I really like it, and I think they're going places with it. So next week, I am going to have my first guest appearance, I think. One of my buddies, Kris, I hope to have on. He'll be talking about the ambulatory side of the EHR, which is what he specializes in. So looking forward to that. And if you haven't liked our page on Facebook, Med Preservation Inc. yet, I encourage you to do so. Hit that little button down. It's over there. It's somewhere. Yep, right there. Hit that one. And give us a like. Give us a share. I would appreciate that so much. And we'll be bring some more of these vlogs to you very soon. So with that, I will sign off. And I want to encourage you to be kind, be careful, and always choose joy.